Get this. Imagine a world where healthcare is practically invisible. Like it's constantly monitoring your well-being without you even having to lift a finger. That's the kind of future Dr. Wen-Te Lu is building, and today we're going to take a deep dive into his groundbreaking work, specifically in thoracic medicine.
You know, what's really captured my attention with Dr. Liu is just how prolific he is. I mean, he's secured 17 patents in just 4 years, from 2021 to 2025.
Wow, that's incredible. That's like a new patent practically every few months.
It is.
So where do we even begin with 17 patents worth of groundbreaking research?
Well, a good place to start might be with sleep. Dr. Liu's team can actually detect sleep apnea with the same accuracy as a sleep lab, but get this, without you wearing a single sensor.
Hold on, are you serious?
Yeah.
How can they tell if someone has sleep apnea without any wires or masks or gadgets?
They've figured out a way to use millimeter wave radar. It's this little device that sits by your bed and sees your breathing.
It's like an invisible radar system, but instead of tracking planes, it's monitoring your chest movements as you breathe.
Okay.
Wow, that's pretty wild.
And it's not just the theoretical concept either. I mean, this is already being used in hospitals and homes in Taiwan, and it's on track to get FDA certification. There was even a research paper published in 2024 comparing this radar technology to traditional sleep studies, and guess what? It was practically just as accurate.
Wow, that's really impressive. So no more uncomfortable sleep studies in a lab. You just settle in at home and let the radar do its thing.
Exactly. And here's where it gets even cooler. They're actually taking this tech to the next level by using AI to actually predict apneas before they even happen.
Wait, hold up. Are you telling me they can predict the future of my breathing? How is that even possible?
It all comes down to subtle changes in your heart rate that happen right before an apnea. So basically, when your airway is about to close up, your body starts to kind of fight back. And this shows up as tiny variations in the time between your heartbeats.
So it's like my heart knows my airway is about to collapse before I do.
Exactly.
That's a bit freaky, but also kind of amazing.
Yeah, and Dr. Liu's team figured out how to detect those tiny heart rate changes and use that information to actually adjust CPAP machines in real time, preventing the apnea from happening in the first place.
Okay, I'm officially blown away. It's like a CPAP machine that can read your body's signals and adapt on the fly. So this is all happening because of a connection between breathing and heart rate. I never would have guessed those two were so intertwined.
Yeah, you're right. The connection is pretty remarkable. And it's not just relevant to sleep apnea either. Dr. Liu is also exploring how this non-wearable technology can be used to monitor heart failure, which, as you know, is a pretty serious condition.
Absolutely. Heart failure is a huge health concern. So how does this radar technology play a role in managing it?
Well, one of the major challenges with heart failure is that a lot of patients develop irregular breathing patterns because of a kind of miscommunication between the heart, lungs, and brain. It's like their body is struggling to regulate their breathing effectively.
So it's like their breathing gets out of sync because of the heart problems.
That's a great way to put it. And Dr. Liu is actually using the same wireless radar to monitor the breathing patterns of these patients while they sleep to see if there's any correlation with how their heart is functioning.
That's fascinating. So he's looking for clues in their breathing that could tell us more about their heart health.
Precisely. And in a pilot study he conducted, he found that patients with more, erratic breathing during sleep tended to have weaker heart function. It's like their breathing is giving us a window into what's happening with their heart.
Wow. It's like having an early warning system for heart failure built into the way we breathe. This could be huge for managing the condition and preventing hospitalizations.
Exactly. And it's a testament to Dr. Liu's ability to see these connections that others might miss. I mean, he's constantly looking for innovative ways to use this technology, and he's also doing groundbreaking work in the field of hemodialysis.
Okay. I'll admit I'm not too familiar with dialysis. What's the connection to breathing in the lungs there?
Well, dialysis is a life-saving treatment for people with kidney failure. It essentially filters their blood when the kidneys can't do their job. And it turns out there are a few key connections to breathing. For example, fluid overload in kidney failure can lead to fluid buildup in the lungs, making it harder to breathe. And dialysis itself can sometimes cause low blood pressure, which also impacts breathing patterns.
So Dr. Liu's using this technology to keep a close eye on dialysis patients and potentially catch these problems before they become serious.
You got it. He's actually using a combination of radar and motion sensors to monitor patients in real time during their dialysis sessions. So the radar tracks their breathing to assess fluid levels and congestion in the lungs, while motion sensors are looking for subtle movements that could signal a muscle cramp, which is another common issue during dialysis.
This is like a two-pronged approach, keeping tabs on both breathing and movement.
Yeah.
How extensive is this research? Has he been able to apply it in real-world settings?
Oh, it's quite extensive. He's established a network of radar-equipped dialysis units across 3 different hospitals and has already recorded over 1,600 dialysis sessions. And they've already seen some incredible successes using this tech to detect problems early on.
Really? Can you give me an example?
Absolutely. In one case, the system detected a patient's blood pressure was about to drop dangerously low, minutes before a standard blood pressure cuff would have picked it up.
Wow.
This early warning gave the care team valuable time to intervene and prevent a serious issue.
That's amazing. It's like having a sixth sense that can anticipate problems before they even happen.
Exactly. And in another case, they were actually able to predict a muscle cramp based on subtle changes in leg movement and breathing. Imagine being able to stop a cramp before it even starts.
Wow. This technology has the potential to completely change how we approach dialysis treatment, especially for those who do it at home.
Absolutely. And speaking of pushing boundaries, Dr. Liu's vision doesn't stop there. He's exploring even more advanced technologies that could revolutionize the way we think about healthcare.
Now you've really got me intrigued. What kind of futuristic tech are we talking about?
Well, imagine a world where your clothes, your bed sheets, even your furniture could monitor your health without you even knowing it.
Okay.
It sounds like science fiction, but it might be closer than you think.
Okay, my mind is officially blown. Clothes and furniture monitoring my health. Sounds like something straight out of a sci-fi movie.
It might sound futuristic, but it's based on some very real science. Dr. Liu is at the forefront of developing these incredibly sensitive, yet practically invisible sensors. One area he's exploring is even more advanced radar systems. Imagine radar that can track the movements of multiple people at once, differentiate between individual heartbeats, and even map movements in 3D.
Whoa, hold on. 3D mapping of movement. What would be the benefit of that level of detail? It sounds incredibly complex.
Think of the possibilities. Imagine being able to track subtle movements in, like, a therapy session, giving therapists a whole new layer of insight into how people are responding to each other. Or consider physical therapy for stroke patients, using 3D mapping to precisely track their progress as they regain motor function.
It's like gaining a superpower to see the nuances of human interaction and recovery in a way we never could before.
It's a powerful tool with incredible potential. But radar is just one avenue Dr. Liu is pursuing. He's also looking into something called NFOPT, non-invasive fiber optic physiological monitoring technology.
Okay, you're going to have to break that down for me. NFOPT. What in the world is that?
Imagine this sensors woven into your bed sheets or even your clothing that can monitor your heart and breathing with clinical-grade accuracy. That's the power of NFOPT.
Wait a minute. Sensors in my clothes. So I could be walking around, going about my day, and my shirt would be tracking my vital signs. That's both amazing and a little creepy at the same time.
I know it sounds like something out of a spy movie, but it's all based on the incredible sensitivity of fiber optic cables. They can pick up on tiny pressure changes caused by your heartbeat or the expansion and contraction of your chest as you breathe.
So even the slightest movement or pressure change can be translated into meaningful data.
Exactly. And because these signals are transmitted using light, they're not affected by electromagnetic interference like traditional electronic sensors are. Think about how many electronic devices we're surrounded by every day. This technology could be a game changer, especially in hospitals where all those electronics can interfere with monitoring equipment.
That makes a lot of sense. It sounds like NFOPT has the potential to make healthcare more reliable and accessible no matter where you are. We could be talking about transforming everything from home health monitoring to remote patient care in underserved areas.
You're hitting on all the key points. Dr. Liu's work is truly revolutionary. But like with any new technology, we have to consider the challenges as well.
Good point. What are some of the hurdles that need to be overcome before this becomes a reality for everyone?
One of the biggest challenges is ensuring accuracy and reliability in real-world settings. A sensor might work perfectly in a controlled lab environment, but how does it perform in a bustling hospital room or a typical cluttered home? Those are very different environments with lots of potential for interference.
Right. It's one thing to have a cool idea, but making it work seamlessly in people's everyday lives is a whole different ballgame.
Exactly. That's why Dr. Liu and his team are working hard to develop robust algorithms and machine learning models that can filter out all that noise and accurately interpret the signals from these sensors.
So it's not just about the hardware itself. The software plays a crucial role in making all of this data meaningful.
Absolutely. And we can't forget about data security and privacy. We're talking about collecting incredibly sensitive health information, so making sure that data is protected from unauthorized access is, paramount.
That's a huge concern. People need to feel confident that their personal health information is being handled responsibly and ethically.
I completely agree, and that's something Dr. Liu takes very seriously in his research. He believes that privacy and security should be top priorities as these technologies are developed and implemented.
That's reassuring to hear.
Mhm.
I think as these technologies advance, the ethical considerations need to evolve right alongside them.
Couldn't agree more. And there's also the challenge of integration. We need to find ways to seamlessly blend these non-wearable technologies into existing healthcare systems and workflows. Hospitals and clinics are already juggling complex systems and procedures, so introducing a whole new layer of technology needs to be done carefully to avoid disruption.
Yeah, I can imagine it'd be pretty chaotic if we just threw these new technologies into the mix without careful planning.
Exactly. It's about figuring out how to implement these advancements in a way that's efficient, effective, and truly beneficial for both patients and healthcare providers.
It sounds like we're talking about a multifaceted challenge that requires collaboration between researchers, clinicians, and even policymakers.
It's definitely a complex puzzle, but the pieces are starting to come together.
And Dr. Liu seems to be playing a key role in putting those pieces together. This whole conversation has been eye-opening. I had no idea how far this technology had come or the incredible potential it holds.
It's an exciting field to be in, and I think we're only just scratching the surface of what's possible. But before we get too caught up in the what's next, I think it's worth taking a step back to understand how we got here. How did this whole idea of monitoring health without physical contact even begin?
That's a great point. Sometimes we get so focused on the what's next that we forget to appreciate how far we've come. So let's rewind a bit. What are the historical roots of this technology?
Well, the idea of monitoring health without physical contact actually goes back further than you might think. In fact, the roots of this technology can be traced back to World War II.
Wait, really? World War II? I never would have guessed that.
It might seem surprising, but one of the earliest examples of this kind of monitoring involved using radar to track heart rate and breathing. And you guessed it, this radar technology was initially developed to detect enemy aircraft.
So the same technology used to locate planes in the sky was also used to monitor heartbeats. That's mind-blowing.
It's a classic example of how technology developed for one purpose can often have unexpected applications in other fields. Scientists realized that the same principles used to detect planes could also be applied to pick up the subtle movements of the chest caused by the beating heart and expanding and contracting lungs.
That's incredible. Talk about thinking outside the box. So how did they transition from tracking planes to monitoring hearts? Was it a smooth process?
Not exactly. After the war, scientists began exploring the medical potential of radar. They worked on developing more sensitive systems that could pick up even the slightest movements, making it possible to monitor heart rate and breathing without needing any physical contact.
I can see how that would have been a major breakthrough, especially for patients who might not be comfortable with traditional monitoring methods.
Exactly. But these early radar systems were bulky and expensive, and the technology wasn't quite refined enough for widespread use in healthcare settings. It took time for the technology to catch up with vision.
So what were the key advancements that finally made this technology more practical for everyday healthcare?
One of the biggest leaps forward was the development of millimeter wave radar. This type of radar operates at a much higher frequency than traditional radar, which allows it to detect even smaller movements with greater precision.
It's like trading in a blurry old camera for one with ultra-high definition. Suddenly you can see all these details that were previously invisible.
Exactly. And along with improvements in radar technology, the development of microelectronics and digital signal processing also played a crucial role. These advancements paved the way for smaller, more affordable radar systems that could be used in a wider range of settings.
So it sounds like it was a combination of advancements in both the hardware and software that really made this technology take off.
Precisely. And in recent years, the field has been further revolutionized by the incredible power of artificial intelligence and machine learning.
Of course. AI is everywhere these days. But how is it being used to improve non-wearable health monitoring?
Well, think of it this way. These sensors are collecting vast amounts of data. AI algorithms can sift through all of that information in real time, identifying subtle patterns and anomalies that would be nearly impossible for humans to detect.
It's like having a superpower detective working tirelessly behind the scenes to make sense of all the clues our bodies are giving off.
That's a great analogy, and that's what makes this technology so powerful. It's this synergy between advanced sensors, sophisticated algorithms, and machine learning that's driving this revolution in healthcare.
We've come a long way from radar systems tracking planes to AI-powered sensors in our clothes. It's an incredible journey. But where do we go from here? What's next on the horizon for non-wearable health monitoring?
The future is brimming with possibilities. We're on the verge of a new era in healthcare, where technology will play an even greater role in how we monitor, diagnose, and treat diseases.
Okay, paint me a picture. What does this future look like? What will healthcare look like in a world where non-wearable monitoring is the norm?
Imagine a world where your doctor can monitor your health continuously, not just during those brief office visits, but like 24/7. Imagine sensors embedded in your home, your car, even your workplace, all seamlessly gathering data about your vital signs, sleep patterns, activity levels, and even your emotional state.
So it's like having a virtual doctor by your side at all times, constantly watching over you and making sure everything is running smoothly.
In a way, yes. And this constant stream of data will give doctors the ability to detect problems early on, potentially preventing serious illnesses from developing in the first place.
It's like a pre-crime division for healthcare, catching diseases before they even have a chance to take hold.
I love that analogy. And it's not just about prevention. Imagine a world where your medication dosages are automatically adjusted based on real-time data about how your body is responding to treatment. Imagine personalized therapies tailored to your unique genetic makeup and lifestyle.
That's personalized medicine on a whole new level. It's like having healthcare custom designed just for you.
Exactly. And it's all made possible by the remarkable advancements in non-wearable technology.
So we're talking about a future where healthcare is more proactive, more personalized, and more data-driven than ever before.
That's the vision. And it's a vision that's becoming more tangible every day thanks to the work of pioneers like Dr. Liu. His research is paving the way for this new era in healthcare.
After hearing all of this, I'm both incredibly excited and slightly intimidated by the possibilities. It's a lot to wrap my head around. It makes you wonder, though, what are the ethical implications of all this monitoring? Where do we draw the line between helpful data collection and an invasion of privacy?
Those are very important questions, and ones we need to be discussing more as this technology advances.
It really makes you think, at what point does all this health data become too much? Where's the balance between these groundbreaking advancements and, respecting our personal boundaries?
Yeah, you've hit on a really crucial point. I mean, we can't just blindly embrace new technology without considering the ethical implications, right? Transparency, consent, and data security all need to be at the forefront of these developments. We have a responsibility to make sure these advancements benefit humanity as a whole, not just a select few.
Absolutely. It's a conversation that needs to be happening alongside the research and development. But let's shift gears a bit. You mentioned earlier that Dr. Liu is involved in some really fascinating research on interpersonal interactions. What exactly does that entail?
It's one of the most intriguing areas of his work, in my opinion. Dr. Liu has developed a system that analyzes physiological data, things like heart rate, breathing patterns, even those tiny, almost imperceptible facial expressions, to gain insights into how people respond to each other emotionally and cognitively during conversations or interactions.
So wait a minute. Are you telling me this technology can practically read our emotions? Even if we're trying our best to keep a poker face?
Well, it's not mind reading in the literal sense, but it's getting pretty close. By analyzing these subtle physiological cues, the system can provide a deeper understanding of our subconscious responses to others. It's like peeling back the layers to see what's really going on beneath the surface.
Okay, that's both fascinating and a little unnerving. What are some of the potential applications of this kind of technology? It sounds like it could be revolutionary in so many fields.
The possibilities are, really mind-boggling. Think about couples therapy, for example. Imagine being able to use this technology to help partners understand each other's emotional triggers and communication styles. It could transform the way we approach conflict resolution and build stronger, healthier relationships.
That's a fantastic example. I can see how understanding those subtle, unspoken cues could be incredibly beneficial in therapy. It's like giving couples a whole new language to communicate their feelings and needs.
Precisely. And it doesn't stop there. Imagine the impact this technology could have in the workplace. Think about using it to assess team dynamics, identify potential conflicts before they escalate, and improve communication and collaboration. It could revolutionize the way we work together.
It's like having a secret weapon to build more effective and harmonious teams. It could change the entire landscape of organizational development and leadership.
You're getting it. And the potential applications extend even further. Consider fields like law enforcement or national security. Imagine being able to use this technology to, say, detect deception or assess the credibility of witnesses. It could be a game changer in criminal investigations and intelligence gathering.
Wow, the implications are far-reaching to say the least.
Yeah.
But as with any powerful technology, we have to be mindful of the ethical considerations. There's a fine line between using this knowledge for good and potentially crossing over into dangerous territory.
You're absolutely right. As with all of Dr. Liu's work, responsible development and ethical considerations are paramount. We need to be cautious about how this technology is used and make sure it doesn't become a tool for manipulation or exploitation. Open and honest conversations about the potential risks and benefits are crucial as we move forward.
Absolutely. It's a powerful tool, and like any powerful tool, it can be used for good or for evil. We need to be proactive in establishing guidelines and safeguards to ensure it's used responsibly and ethically.
I couldn't agree more. It's about finding that delicate balance between pushing the boundaries of what's possible while remaining mindful of the potential consequences. Dr. Liu understands this, and he's committed to developing these technologies in a way that benefits humanity as a whole.
Well, after this incredible deep dive into Dr. Liu's work, I'm left with a sense of both awe and cautious optimism. The future of healthcare is unfolding before our very eyes, and it's more exciting and transformative than we ever imagined.
It's an incredible time to be alive, and Dr. Liu is a shining example of the power of human ingenuity and innovation. His vision and dedication are paving the way for a healthier and brighter future for all of us.
To our listeners, thank you for joining us on this journey into the world of non-wearable technology. We hope you found it as thought-provoking and inspiring as we did. Stay curious, stay informed, and keep exploring the endless possibilities of science and technology.
This is The Deep Dive signing off.